John Speller.
Number 7, Mr. Speaker.
Minister.
Thank you, Mr. Speaker. The Community Pharmacy Contractual Framework outlines a transformational programme of work to integrate community pharmacy into the NHS, delivering more clinical services and making them the first port of call for many minor illnesses. The framework commits £2.5 billion annually to the sector to support this ambition.
John Speller.
That's a very welcome response from the Minister, and it shows that the Minister and the Department seem to be now recognising the work of our pharmacies for their magnificent efforts during the pandemic, providing frontline primary care and also delivering and encouraging vaccination. So can she further recognise their expertise and dedication and push rapidly forward with integrating pharmacies into the delivery of primary care, thus also, of course, easing pressure on GPs and hospitals?
I thank the honourable gentleman for his question. He will find no greater supporters of community pharmacists than this government, and that's why this government launched the Community Pharmacist Consultation Service, where GPs and NHS 111 can refer directly patients to pharmacy services, and we now see pharmacies dealing with minor ailments such as sore throats and coughs and colds, providing the new medicine service, and providing public health services such as weight management and stop smoking services. We place on record our thanks to all in community pharmacists.
Thank you, Mr. Speaker. Community pharmacists in my constituency have played a crucial role during the pandemic, not least in providing vaccines, as at Hewenden Valley. Will my honourable friend join me in thanking them, as well as the pharmacists working in GP surgeries such as Meadowcroft in Aylesbury, which I visited last week, because their growing role in primary care is an important part of our efforts to improve the health service and ensure patients get the best possible care.
I thank my honourable friend. He makes some excellent points, and I do want to put on record once again our thanks to community pharmacists and all of the community pharmacy teams. During the pandemic, over 1,500 community pharmacy-led COVID vaccination sites have been set up, delivering 15 million COVID vaccinations so far. And this winter, over 3.8 million flu vaccines have been delivered through community pharmacists, showing they are leading the way in primary care.
Thank you, Mr. Speaker. The role of community pharmacies across Angus and Scotland can't be underestimated during the pandemic, and the way that they were able to alleviate the pressure on clinical services in the wider NHS, it must be noted. And that's why the Scottish Government have introduced their Pharmacy First service, backed by £7.5 million last year, going up to £10 million. Can the Minister assure me that the lessons that we've learned in Scotland are being accepted by Whitehall? And if she wants, would she like to come to see the lessons we've learned in Scotland? I'd be happy to accompany her.
Thank you, Mr. Speaker. As I've said, this government is leading the way in England in the way community pharmacy are transforming services in primary care. And that's why we have the new medicine service, where patients with conditions such as asthma, high blood pressure or on blood thinning medication are able to go and see their pharmacist as a first port of call to manage their medication. And we will be expanding those services and are in discussion with community pharmacists about how we take that forward.
Question 13, Mr. Speaker.
Thank you, Mr. Speaker. The Kent and Medway CCG have informed us that all practices in the area have open lists and are accepting new patients. And they have also informed us that practices in Sittingbourne and Sheppey are being prioritised for support to help them manage the high levels of demands they are currently facing.
Thank you, Mr. Speaker. I think the Minister's been misled by my local CCG. I can tell her that all the GPs in my area are oversubscribed, and people find it very difficult to get an appointment with their GP, including even virtual appointments. Indeed, some patients struggle even to speak with a receptionist because their phones are engaged for hours on end. Now, I understand the NHS is planning to give GPs upgrades of their telephone systems, but such upgrades will be of no use whatsoever unless doctors have the resources needed to recruit and train additional receptionists to answer the phones. So what assurances can my honourable friend give me that the GPs will get those resources?
Thank you, Mr. Speaker. We recognise the difficulty patients have had, particularly with telephone access, and GPs have fed in that phone lines have been more busy than ever, and that's why the Secretary of State in the Winter Access Fund has addressed this in two ways. There is the availability of the telephone cloud-based system that GPs and PCNs can be part of that will help build their telephone capacity. But there is also the £250 million Winter Access Fund, which GPs can use to either recruit more telephone receptionists, train up existing telephone receptionists, or build up more resources. And I'm very happy to discuss that further with the honourable gentleman.
Sarah Green.
Thank you, Mr. Speaker. Women across the country have lost jobs and life savings due to chronic pain and disability caused by complications after the use of medical mesh. Many, including one of my own constituents, have had to pay for corrective surgery overseas. The government has so far refused to set up agencies to provide financial redress, as recommended in the Cumberledge report. Will the Secretary of State revisit the Cumberledge report and, in particular, that need for financial redress?
Thank you, Mr. Speaker. Women who have suffered adversely are being helped, supported through the difficult choices they're having to make. This government has set up 8 specialist mesh centres across the country to be able to provide them with the specialist treatment they need. Our priority is patient safety in preventing anything like this happening again, but also the support of those women who have been affected. There isn't any evidence that a redress system would improve patient safety or improve the outcome for those women.
Syringing is no longer being undertaken in local surgeries, and as self-care doesn't work for many people, will the government make sure that microsuction is at least available in every primary care network area? Otherwise, we're leaving people to go deaf.
I thank my honourable friend for his question. Local commissioners are responsible for meeting the health needs of their local population and should continue to ensure appropriate access to earwax services. However, should a CCG not routinely commission earwax removal or the suction method that he refers to, a patient can request an individual funding request. I'm happy to help my honourable friend if that's not happening locally.
Thank you. Cancer targets aren't being met. This September saw the worst figures on record for both the 31-day and 62-day targets, and the 62-day target hasn't been met since 2015. Extra funding's welcome, but where's the detailed implementation plan that was also promised to follow?
I thank the honourable gentleman for his question. Can I reassure him that during the pandemic, cancer has remained an absolute priority for the NHS, and it will continue to do so. And with the funding that's been awarded to deal with the long-term electives, that does include cancer referrals too. And we have some amazing work in our cancer alliances that are looking to deal with the urgent backlog that's developed during the pandemic.